Welcome. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us for another segment. We're going to be speaking with returning guest Dr. Susan Mitmesser. She's VP of Science and Technology at Pharmavite, the makers of nature-made vitamins and supplements. And she's joining us here on the program to talk about a review paper by Pharmavite that was recently published in Nutrients, where the correlation between nutrient inadequacies, immune function, and weakened immune response is shown in American adults. Welcome to the program. Thanks for coming back, Dr. Susan Mitmesser.
Hi, thanks for having me, Neil.
Well, for our listeners who may not be familiar with you, I did, of course, mention that you're VP of Science and Technology there at Pharmavite. How did what is your area of expertise, and what is Pharmavite's mission?
Yeah, so I have a PhD in nutrition biochemistry, and really I'm a lipid biochemist by training. But at Pharmavite, I really lead the early discovery phase of our research team, and we are the scientific foundation and backbone of the organization. So we run and conduct a lot of research on a wide variety of micronutrients and other compounds that affect the outcome of human health.
Last month, Pharmavite published a review study. It highlighted, as I mentioned, some research showing a significant number of adults here in America are falling very short in consuming critical nutrients. Talk about this study, its purpose, and its results.
Well, I would love to. You know, we were very excited to see these results, and it was quite timely given the pandemic in which we are in the midst of. So the design of the study was really to leverage NHANES data. And for those of you that are unfamiliar with NHANES data, that's an acronym for the National Health and Nutrition Examination Survey. And this is an annual survey that is conducted by the CDC. And the CDC collects data from a wide variety of Americans to indicate how much of nutrient intake they are getting. So we looked at males and females aged 19 to 99 years of age, and we leveraged a data set that had almost 27,000 adults participating. And what we wanted to understand was, are the nutrients that are super important for immune health insufficient or deficient in the U.S. population? And so we focused on those nutrients that we know are involved in promoting and implementing a good immune function and support. And those are vitamins A, D, E, C, and zinc. So we did a nutrient analysis looking at this, and our primary findings were quite interesting, really. We found that all of those 5 nutrients, there was significant insufficiency in the U.S. population. And when you look at the rate of infection of all types of infection, bacterial and or viral, there's no surprise there, really.
You mentioned this time that we're living in now, given the study results and this current environment. What would you say is the biggest takeaway from the review study based on us rigorously trying to find a solution to this pandemic, or at least a way to live with it as it seems it's going to be around?
Yeah, so I think one of the most interesting things is that Americans are falling short in these nutrients that support immune function. And not only are they falling short of these nutrients, so they're not getting it from their diet, but they are not getting it from their diet in a higher rate. So what that means is, I'll use an example, vitamin C. We found that vitamin C intake, 46% of the population was not receiving adequate intake versus previous published data that said 37%. So that's almost a 10% increase in the population not intaking adequate amount of vitamin C. And I use vitamin C as an example because vitamin C is probably the most well-known micronutrient associated with immune function. So that's pretty profound. We also found that when you take food alone, so we looked at food, but then we also looked at food plus dietary supplements. So those folks that take a dietary supplement. And we found that when you take a dietary supplement, the incidence of intake actually went up. So there was not as big of a gap in the amount of what one should be taking versus when they took the supplement. It kind of filled that gap.
What about the age group? You say you tested or you dealt with 19 to 99. Which age group was more affected by this lack of nutrients? And was any age group more likely to have a better intake, even though overall the intake was low?
Yeah, so the age group that was most profound really was the elderly, and specifically with regard to vitamin E and zinc. We found that the intake for those two were quite deficient and insufficient in the elderly population. So, when you think about what's going on in the world today and who's being affected by the virus infection, this could start to compound someone's ability to actually combat the infection.
So what do you suggest to have folks maintain some strong immune health in taking more of these nutrients?
First and foremost, I think you need to do some self-reflection and figure out, of those 5 nutrients that I mentioned, are you eliminating some of those nutrients? So are there foods you eliminate that would make you more apt to be insufficient in receiving those nutrients? If so, figure out a way to change that. So do you need to change your diet, or do you need to supplement? And I think it's a very individual self-reflection that one needs to have. That's where I would start. But I also think there are other factors that we should consider here. We take a pretty holistic approach to health because our body systems are super interconnected. Sleep affects our immune system, stress affects our immune system, and as we've been talking, nutrition affects our immune system. And so looking at those other factors that affect our immune system is just as important.
Where can our listeners go and get some more information?
A great resource is naturemade.com, in which you'll find the reference of the publication, which we're super proud of. But also, we've been doing a social media video series on immune health. And really, it's breaking down the immune system in very digestible components so that people understand what is the immune system, how does it work, how can I ensure that I am bolstering my immune system in this current state.
Thank you for returning, Doctor. It's been a pleasure, and I'm hoping we'll speak again.
Absolutely. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Susan Mitmesser. She's VP of Science and Technology at Pharmavite, makers of nature-made vitamins and supplements. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.